Thank you very much, Deb. Mr. Premier, my colleague from the legislature and good friend Mark Doherty, glad to see you here. Ladies and gentlemen, patients, this is a very, very good day. I'm very pleased that this research is proceeding and that Saskatchewan patients will have a chance to be involved. I can tell you as the Minister of Health for the last 4.5 years, there are good days and there are better days, but there are a few days that will remain in my mind as the best days, and this will rank right up there, being able to make this announcement on behalf of the Government of Saskatchewan with the Premier. Over the past few years, I've heard from a number of MS patients who are desperate for answers. And as the Premier mentioned, I think we all don't have to look too far out of maybe our family circle or our circle of friends to see friends or family members that do suffer. And some may have very minor symptoms, whether it's numbness, some fatigue, to others that have very obvious effects of MS, all of which are looking for answers. And we hope this research will provide all of those and their family members with much needed answers. The selection process will give every eligible volunteer an equal chance to participate. All applications will be screened, and then patients' names will be randomly drawn. Those patients will be assessed to make sure that they meet the eligible criteria set out by the research team. Dr. Siskin, glad to have you here, who will be able to answer some of those questions and other aspects of the research in a few minutes. We know that there will be some applicants that will be disappointed, but I can assure you that all will be given an equal chance to, first of all, be selected, and if they're selected, some may not meet the eligibility requirements, but all will be given an equal chance. We should also be clear that only half of the volunteers selected for this study will actually receive the liberation treatment. The other half will not. Neither the volunteer nor the physician monitoring them will know who had the full procedure and who did not. This double-blind, as was mentioned already, procedure will help maintain the integrity of the research and its findings. I sincerely want to thank Dr. Siskin and his team for giving our patients the opportunity to be involved. We appreciate the involvement of those who will work here in Regina and participating patients during this study, including the Radiology Associates of Regina. I encourage all interested patients to visit the Ministry of Health's website or to call our toll-free number to find out more or to apply. We will continue to pursue options for those suffering from MS, and we will always keep patients' needs first in our mind as we move forward in Saskatchewan. So thank you, and I'll be looking forward to answering any questions into the future. Thanks.